Hi, this is Dr. Steve Shore, the elderly partner at Sandy Springs Pediatrics. In addition to my work as a pediatrician, I am also a specialist in pediatric infectious diseases with some special training in viruses and virology in England and at the Centers for Disease Control in the 1970s. As you know, we have an epidemic of coronavirus called COVID-19 going around. Fortunately for children, the infections in kids are relatively mild and frequently are even going to be asymptomatic, so that we can assure you that most kids with COVID-19 infections are going to be fine. Of course, we have concerns for elderly patients and patients with conditions, and we have to keep a more careful eye out for them, but we can reassure you that your kids in almost all circumstances will do well. Each appointment that is scheduled is screened for exposure to the COVID virus and for symptoms that we think are compatible with a virus infection. If you are concerned that your child may have COVID-19, there are a number of things you'll want to do, which I'm going to enumerate. First, please state that you are concerned for the COVID infection immediately when you call, and that will orient our nurses properly. Secondly, our nurses will triage you by phone to determine if the criteria for COVID-19 are met, and this will be reviewed by our physicians. Next, once your appointment is made, you are to stay in your car when you arrive. We have special spots that are dedicated to this. Next, your check-in, your payments, and visit history will be taken over the phone. Only one caregiver may accompany the patient at a time, and both of you, both your child and you, should be wearing masks. If you don't have a mask, we will provide it for you. You will be allowed into the practice via the backside entrance, and you'll be taken immediately to our designated room for potential COVID-19 patients. You will then be let out as soon as your visit is complete via the same route.